ML still waiting for the elevator? Oh, you're back there. All right, I was going to tell you, you need to use the stairs. They're always working.
Hi, Denise.
All right.
Good to see you.
Well, good afternoon. I'm joined today by Dave Meador of DTE Energy, Matt Cullen of Bedrock, Fame Brown, serial entrepreneur in the city of Detroit, and Denise Fair, our health director. Let me start today with good news. So my first phone call today was from Kirk Tanner, who's the CEO of Pepsi. And Pepsi's a major employer in the city. They have a major bottling plant on Mack Avenue where they employ 400 or 500 people. And he was calling to say that Pepsi was going to support Detroit's coronavirus efforts. And Pepsi is today donating $600,000 through the Community Foundation and the Urban League. They're doing it for food and other needs for children and seniors. They're doing it for testing and contact tracing. They're doing it to support a number of minority business ventures. And Pepsi now joins quite a series of national companies who have taken an interest, and we deeply appreciate the fact the country seems behind us. The other person I want to thank today may not be a familiar name for most Detroiters, but everybody in city government knows him, our Deputy Corporation Counsel Chuck Ramey, who still has not lost a case. But in the last week, there was a terrible verdict, about $3 million against a police officer who had somebody in custody for about 2 hours. And the Federal Court of Appeals reversed that and dismissed the case, which saved the taxpayers of the city about $3 million. And then today, Chuck won the biggest lawsuit. We had a law firm in this town that didn't think you should be able to collect income taxes on the work being done in this city. But the Supreme Court today unanimously ruled that our income tax collection process was being done legally. Had we lost that case, it would be far more financially devastating to our future than anything that's happening with COVID-19. And I deeply appreciate that 7-0 vote of the Michigan Supreme Court, and Dave Masseron, our CFO, is already on the phone with the rating agencies. We were confident in how this case was going to come out, but the rating agencies like to actually see the court ruling before they reach a conclusion. But a special thank you to Chuck Ramey, who continues to succeed at everything he touches for the people of the city. When we were last here on Friday, we reported 1,243 deaths. Today it's 1,263 deaths, 20 more deaths reported 3 days later, although as has often been the case, many of those were from earlier in the month. So I'll take you through again our numbers so you can judge for yourself whether we're making the progress we should be making. My goal is to have half as many deaths each week as the week before. And with the latest update, which is actually through Friday, we always delay a couple of days because I don't have any confidence in the Saturday and Sunday numbers till they've had a chance to collect up for a day or two of the work week. But the week of April 11th, we lost 282 Detroiters. That was the worst part of this epidemic. The next week, it dropped to 171. 3 weeks ago to 102. 2 weeks ago to 69, and then in the last 7 days, 38. So what we are doing is continuing to work, and it's a combination of the social distancing and the job that Denise Fair and the health department have done with the nursing homes is a major factor. And I'm really pleased with the fact that the health department is already halfway through its second pass through the nursing homes and will have retested every nursing home patient a second time by the end of this week. So as we pay this kind of attention to our seniors, it is affecting the fatality rate in this city in a remarkable way. The other thing is this. I am really pleased to announce what has been my goal from day one. We will now be opening, as of Wednesday, testing for every single Detroiter who wants a test at the fairgrounds. Everybody. You don't have to have a prescription. You don't have to have a doctor. You don't have to have symptoms. Starting Wednesday, anybody who's a resident of the city of Detroit can go through the fairgrounds and get a free test. And we are one of the few places in the country, and certainly the only place in Michigan, where every single resident can get tested. This is what we needed to do. We needed to make the testing available to everybody. The one thing you need is a Detroit ID. I wish we had the resources to test everybody in the suburbs, but we don't. But we are the city of Detroit. So if you've got a driver's license, state or city ID, a document showing where you live, we'll take everything within reason. Utility bill, pay stub, lease agreement, something that would give us an objective evidence that you are a Detroiter. And so you will be able to call up, but you have to have an appointment. You can't just drive up. There are places in the country that drive up, so they had 7-hour waits, people in their cars. We haven't had that problem. Quicken has done such a beautiful job with the appointment process. But you can call today, and if you are, we're already taking everybody over 60, we're already taking workers, we're already taking people with symptoms. But for anybody else, you can call today and start booking as of Wednesday. Wednesday, Thursday, Friday, all day. You live in the city of Detroit and you want a test, you can get a test. You don't need a doctor, you don't need money, you don't need symptoms. Every Detroiter can get a test. And if you don't have a ride, when you call the Quicken folks at this phone number, they'll arrange for a van to take you there. The fare is $2. If you don't have the $2, they'll take you anyway. We wanted to create the city where every one of our residents could get immediate testing, and we have done that now. And I want to thank Ascension Health, which today has joined us, DMC, Henry Ford, and Trinity. We will always be enormously grateful for. They staffed this site from the beginning, and Wayne State Medical School has helped. Now Ascension has joined as well. So they have given us the resources that allows us to expand this to every single Detroiter. So with all of the Detroit healthcare systems pitching in together, you can get tested. Call this number, get an appointment, and you'll be able to ease any doubt that you have about whether you are or not infectious. I want to talk about reopening businesses. So the governor has said that we are in phase 3. The standard for phase 4 is that cases, hospitalizations, and deaths are clearly declining. There's no doubt that we are in phase 4 as it's been defined. The number of hospitalizations is down by 2/3. Our infection rate is now down to 5% of the people coming through the fairgrounds. It's dropped dramatically, and of course, the fatality rate I just showed you. So I am assuming that in the not too distant future, the governor is going to declare the city of Detroit eligible for phase 4 and to allow retail businesses. At least the way the phases had been described in the governor's orders so far, this would apply to other retail businesses and offices. It doesn't apply, at least as has been published, to restaurants, but it would apply to stores and offices. And so we don't want to wait for the governor to say it's phase 4, go ahead and open. What we wanted to do was have a plan in place, because anybody who runs a business knows you don't just decide to open the doors tomorrow and flip the switch. You have to prepare. And in this case, you're going to have to show both your employees and your customers that you've done this in a thoughtful way so that they will be open safely. And the one thing we're not going to have in the city of Detroit is to have a bunch of businesses open, have the infection rate spike, and have to close them again. And so we put in a huge amount of preparation, and the individuals with me today are a big part of that. So we now have a website called DetroitMeansBusiness.org. If you have a business in the city of Detroit, you can go on this website. We'll give you a playbook to open and a lot of support. So Dave Meador is here. Jerry Anderson from DTE has been the leader in this from the beginning. Dan Gilbert has been terrific, and Matt Cullen is here representing him, the McKinsey Group, and a whole range of partners in developing this. They have not only got a playbook on how to reopen, they're going to give you resources if you need masks, gowns, PPE, or if you need financing or technical advice. There's going to be a whole range of support, because it's not enough just to open our doors. We need our businesses to succeed, and they've basically been shut down 7 or 8 weeks now. We need to get cash flowing to them pretty quickly, because they're a huge part of our economy. So if you go to the website right now, there is a reopening playbook to run your business safely. It'll show you what you can do to have every one of your employees tested before they start. And if you call us at the number I gave you, we will get every one of your employees through the fairground site so you know that they are coronavirus free. We strongly encourage you to have your employees' temperature checked, and you might want to think about your customers. I walk into work every day, and a person in my office holds a thermometer near my forehead. It takes 3 seconds. Make sure I'm not running a fever. There are places in this country that are doing it to their customers as you come in the door, and it's reassuring to everybody. But for sure, you should be doing it for your employees. Obviously, you need to be distancing appropriately. You have to be wearing masks, depending on whether you're interacting with customers. If you're interacting with customers, you probably want the heavier N95 masks. If it's just coworkers, you're totally appropriate to be wearing the kind of mask that I usually use, which is a basic surgical mask. That keeps me from breathing on somebody else. So even though I've been tested, the last time I was tested was 10 days ago, on the off chance that I got it in the meantime, I wear that mask every day so the coworkers in the 11th floor of City Hall don't inadvertently get it from me, and all of my coworkers are wearing the same surgical mask so that I don't have to worry about inadvertently getting it to them. We'll show you how to do that. We'll show you the cleaning protocols you ought to be using and where you can get your PPE so that you don't run out of masks in the middle of the day and be scrambling. That playbook is all on the website. And so we'd encourage you to make a reopening plan today. And I think business ought to post it on your website. Post it at your workplace. Say, this is our plan. Because what the hospitals have already found, and I'm going to tell you the businesses are going to find this too, the hospitals are reopened today and they are absolutely safe. But people are afraid to go in there. You're going to find that with a lot of your businesses. If you've got customers coming in, I would really encourage you to put out a reopening plan that shows customers why they're safe. I think it will speed the return of customers to your business. So also on this site, DetroitMeansBusiness.org, every business owner in this city thinking about opening it up, even if you're open, can go on there. They'll show you where you can get PPE. At this point, the city can get tons of PPE. Big companies like Quicken and DTE, hospitals can get PPE. But if you're in a little small shop and you don't know where to get it, we will be able to show you how to get it quickly and in the numbers that you need. They're going to run webinars for you to show you how to operate the business safely. And there's a lot of financial and technical resources on how to keep your business going and to continue to build it in the COVID area. All of that will be on this website. And so we've had 33 different philanthropic groups, companies. All 33 of these folks have come together because they want to give you resources on how you can succeed in getting these businesses reopened in the city. And so I want you to hear from Dave Meador and from Matt Cullen, who have had a big hand in writing this, and then from Fame Brown, who I expect to be one of the first people I go buy something from the day that he is reopened. I will be over at your shop on Livernois, and you're going to have to help me pick out something that will match my style. Probably not a lot that you sell, but we're going to find something that will work. So with that, I'll turn it over to Dave Meador.
Thank you, Mr. Mayor. DTE Energy is proud to be part of this important drive to safely open small business in Detroit. I've been involved in small business development through DEGC and also through the workforce development as I co-chair the Mayor's Workforce Development Board. And unfortunately, both of those efforts have been put on pause by COVID up till now. But now it's time to go back to business and get people back into their jobs. Detroit Means Business has been a collaborative effort, as the mayor described, and it's another example of how government, business, and nonprofit have come together throughout this crisis to make a difference. The city's 36,000 plus small businesses are vital to the economy, and they employ about 50% of the workers in the city. So this is important to both businesses and their employees. As it became clear that Michigan and Detroit were flattening the curve, as the mayor just showed us, the Detroit Means Business Coalition sprung into action, working long days, including weekends, to develop all of the material, the return to work guidelines and instructions that are now part of the website, DetroitMeansBusiness.org. And just wanted to point out it's not .gov or .com, it's a .org, O-R-G, and it's live now as we speak. As part of the opening safely measures, DTE and our foundation want to make sure that Detroit small businesses can keep their employees and customers safe. And that's why we're going to help by providing free personal protection equipment, or we refer to it as PPE, to help the businesses get restarted. Because we have continued to work as an essential business during the crisis, we've learned how important PPE is to both employee and customer safety, especially masks. So as part of the coalition, we're pleased to provide Detroit small businesses next week 600,000 masks, 1.2 million gloves, and 6,000 gallons of hand sanitizer and bottles for the sanitizer to be used. The distribution will be at Easter Market, and it'll be staffed by DT employees. Choctaw, who's a DT supplier, will be making up small business PPE kits with mask, gloves, and sanitizer, and this had been purchased by our foundation. And there will be more information on the website regarding the days and how to go about getting this PPE startup kits at Easter Market early next week. We'll also provide resources, as the mayor mentioned, on the website for employee and customer safety, including signage and safety tools and other equipment. Proper PPE, reopening guidelines, and technical training will ensure Detroit small businesses are ready to reopen in a safe manner when the governor gives the go-ahead sign. Also, through this website, DetroitMeansBusiness.org, small businesses will have access to one-on-one help on how to leverage the state of Michigan's programs, including WorkShare, which can help reduce the cost of labor cost. If you're a small business owner and you need to hire employees, Detroit at Work has talent that's ready to go back at work. Right now, Detroit at Work is helping 150 employers fill more than 3,600 jobs. So for more information on Detroit at Work, you just have to go to the Detroit Means Business website and click on the Detroit at Work icon for more information on finding employees. And that's my report, Mr. Mayor, so thank you.
Yeah. Thank you, Mr. Mayor. Good afternoon. I'd like to begin by expressing my appreciation for the leadership of the mayor, Dave, our friends at DTE, and all the members of the Detroit Means Business Coalition for their focus on small business at this critical time. We at Bedrock and the Rock family of companies are really proud to be a part of this incredibly important initiative. Entrepreneurs and small businesses play an incredibly important role in our local economy. A staggering 50% of the American workforce owns or works at a small business. And I think when you apply that statistic locally, it really makes clear how critically important entrepreneurs are to the fabric of Detroit and how important they will be to our full recovery as we come out of the other side of COVID-19. Dan Gilbert himself is a serial entrepreneur, and small business has been really at the heart of our Detroit strategy since he made his decision to purchase the Madison almost 10 years ago. Dan's always understood that entrepreneurs are the people that help shape the identity of a city and to make it something really special. He's emphasized the importance of supporting small businesses as long as I've known him. So at Bedrock, we've always worked hard to make sure that the downtown attracted not only the big national names, but we also had small local brands located right next door. I think together we've all worked hard and we've created a uniquely Detroit feel to downtown Detroit, and we certainly want to make sure that it stays that way. Our small business community is ready. As the mayor expressed, there's perhaps been no other time when the tenacious nature of entrepreneurs like Mr. Brown has come to the forefront as restaurants pivot to carry out services. Our fitness studios offer online classes, and breweries start making hand sanitizer. Everybody's ready for the re-engagement, and for that reason, I think that Bedrock and the Rock family of companies have committed millions of dollars and significant human resources to building up the resilience of local small business. That's been achieved through rent relief, PPE procurement, grant funding, and a number of other initiatives. And yet, even with all of that effort and the effort of countless others, there's still much more to be done to ensure the future of Detroit small businesses, and that's what brings us here today. So I really think it's inspiring, as Dave said, to see members of the public and the private community come together to make Detroit Means Business resource a reality in such an incredibly short period of time. So I'd like to again thank the mayor and our coalition partners for seeing the importance of making the resources for safe reopening available to our friends and neighbors when they need them most. And to all of the Detroit small business owners, thank you for all that you do, and know that you will have our continued support as we get ready to move forward together. Mr. Mayor?
All right, and the man responsible for Detroit, 313, Fame Brown.
First and foremost, I appreciate you for having me today. I appreciate the city of Detroit for having me. And I really like to say that I appreciate our valued customers' support online during the shutdown. It's been amazing. And without the support of our customers, we would definitely not be able to stay in business or be in business now. I'm excited. I'm excited to reopen our brick and mortar on Detroit's Avenue of Fashion. And at the same time, I'm understanding that our customers' health is what's most important. And so we plan to make some changes, and we've already put some changes in effect that are aligned with the mayor's and the cities of Detroit's playbook, which include spit shield at the register, which is a big deal for us. Our employees wearing masks, our employees being tested, free masks for our customers if they need it. Reduced business hours, reduced customers in the store at one time, markers on the floor for 6 feet separation. And so, although excited to be reopened, we're definitely keeping in mind that this thing has hit our community hard. And it's been serious, and I've lost loved ones. And so I am very intentional about providing a safe shopping experience that will honor what we've all done so far to get to this point. And so once again, I appreciate the mayor, city of Detroit, Mayor Mike Duggan, and shop313store.com. Definitely, shop313store.com. We look forward to serving you.
All right, and Denise Fair.
Thank you, Mayor. So today we have confirmed 10,394 COVID cases and 1,263 deaths. Now, these are just not numbers that I'm reporting. These are our neighbors and our loved ones that have been impacted, and each reported death is one too many. So we stand with you and mourn these losses. Now, the past weekend, the numbers of new reported deaths remain unchanged from Saturday to Sunday. And at first glance, this is really encouraging. However, we are not out of the woods, and I continue to urge caution for a few reasons. State, local hospitals, and other healthcare providers review and reconcile each death record to confirm these records are related to COVID-19, and sometimes corrections are needed. This takes time, which is why the data is fluid. So as the weather breaks and as the mayor prepares to reopen the city, we cannot afford to get relaxed and stop wearing our masks and stop practicing social distancing and stop washing your hands. That is not what we need to do. So I'm asking all of you to continue being responsible and practice safe precautions. So continue to wear your masks and cover your nose and your mouth, even if you feel healthy. Wash your hands or use hand sanitizer. Stay at home unless absolutely necessary. And if you must go out, please practice social distancing. So while the weekly data may be promising, we have to remain focused so that this downward trend of COVID-19 in our community may also continue. Now, switching gears to our seniors. As I always mention, seniors are the backbone of our community. So we are still on the road to testing all of the senior apartment buildings. And so far, we have tested about 1,300 residents and 23 facilities. And the infection rate continues to hover right around 2% in our senior apartments. This week, we will begin to distribute PPE, including masks, gloves, and also hand sanitizer. Eventually, our team will be making return visits to ensure that everyone who wants to be tested gets a test. And in fact, we've already retested half of the 26 nursing homes, as the mayor mentioned, and we are planning to retest the remaining by the end of this week. So that is reassuring. Also, given that all Detroiters who want a test can get a test now at the State Fairgrounds without a prescription, but they, again, must have an appointment, I encourage all residents to take advantage of this. Testing is now available for all, and so, again, take advantage of this opportunity. There's no way around it. We're all connected in this effort to beat COVID-19, because when one person gets sick, they can infect many people, even if they are asymptomatic. So let's stay the course towards protecting ourselves and get tested, because if each of us do our part, we can lessen the number of those getting sick and help to diminish this virus on our community. So with that, I'll turn it back over to the mayor.
We'll take any questions.
Good afternoon. ML Elric with the Detroit Free Press. I wanted to ask about Eastern Market. Eastern Market can be very crowded when people are selling things, but you're going to be giving things away. What sort of measures will be taken so that there's not a crush of people there going to get these products they need to reopen their businesses?
That's a good question. We are working through the process right now, and we envision something similar to the testing protocol that's used at the State Fair, where people would sign up for a time, so they're not all showing up at the same time and end up in a long line. I think the mayor had mentioned that it's really working well there, that we're not having people sitting in a car for hours waiting to be tested, and we want to have the same outcome with the PPE.
Okay.
And that information, the protocol, will be available on the website within a couple days.
And we found with the food that when people just pull up and pop open their trunk and drop it in, you can do it with minimal contact.
And will you, in advance, try and determine how much is appropriate for a particular business? If you have a business that has high volume, they get more. If you have something that's a smaller
Yes,
enterprise,
it'll be part of the sign-up procedure. Obviously, if someone has 50 employees, it's a lot different than if they have 5.
Okay, and that 600,000 masks, the gloves, that's separate from what we're getting from Pepsi?
Right?
Okay.
That's $600,000, so just coincidental number.
Okay, right, okay. And Ms. Fair, with the testing, the second round through the nursing homes, there was an infection rate that was pretty high the first time through. Are you seeing that that rate is much lower, more in line what you'd see with the senior homes, or what are you finding?
Yeah, so we started retesting the first round in middle of April. We tested all 26 nursing homes, and infection rate was about 25%. We have retested the first half. The infection rate has gone down significantly. It's somewhere right around 5 to 10%. And that's really encouraging.
And what do you attribute that drop in? That's a pretty significant reduction.
I think for a variety of different reasons. I think because we acted so quickly and we used the Abbott testing to go in to test this vulnerable population. We also had really good relationships with the nursing directors and provided them education. We helped them with isolating their residents. We also provided some testing for the staff. And I think that's one of the biggest advantages to decreasing infection rates so quickly.
A lot of this is not high-tech. Once we went through and tested and were able to tell the nursing home directors who was infectious and who wasn't, they isolated them. And it really was just a matter of executing the details on 2,000 tests, getting the results back, following up, and now we're going back through a second time, and it's coming down dramatically. So I think the health department and the nursing home staffs have done a very nice job of working together.
Okay. And looking at those very precipitous deaths week by week dropping so much, do you have enough data, or do you have a sense, even just anecdotally, that the reason why the number of deaths are dropping is because of the conduct, the way people are living their lives, or because the most vulnerable were the first to fall, and as we move forward, the weakest are gone and those who are left are stronger, and so...
Actually, we saw the opposite. If you go back to the first 2 weeks of April, we had some young, otherwise healthy people who died in this town, many of them known to us. The hospitals were so overwhelmed that people were being sent home that never should have been sent home. People were put on ventilators while the staff was spread thin. What's happened now is 2/3 of those beds, including 2/3 of the ventilator beds, are open. And so the people who go into the hospital are getting appropriate care. And you're starting to see patterns that are much more common to the seasonal flu, that the folks that we are losing tend to be the very elderly or people with underlying conditions. And that was the whole point of flattening the curve. We've got a great healthcare system that will have a great deal of success treating this if we keep the infection rate down. And I think that's what we are doing now, is we've dramatically reduced the infection rate in this city. So if you look at the last 4 or 5 days, we've been running about a 5% infection rate at the fairgrounds, which means 1 out of 20 Detroiters is infected today. It wasn't very long ago, it was 1 out of 10. And if we keep going the way we are, in another week it might be 1 out of 30. And if we can just keep our masks on, so the 1 out of 20 don't infect 8 of their neighbors at a lunch or a backyard picnic, we can continue to move this the right direction. We're going to have a day when there's no deaths in this city, and I think that day is not too far off.
Okay. And in terms of the masks, I was just at a store last night where many people were wearing masks. There's a sign that says you must wear a mask to be a patron here, but there's still people walking around without masks.
Is that a store in the city of Detroit?
It was just outside the city of Detroit, but
We don't have jurisdiction outside the city, but if it happens in the city, I want to know it, because we will go in and deal with that business.
because, I mean, we've seen it in Flint where people have been hurt trying to turn people away. Is there a point where, as small businesses reopen, you envision they may need to post somebody outside to say, you can't come in unless you're properly?
No, I envision our B-Seed inspectors doing inspections, and I've had reports of different businesses in this town where somebody says they're not wearing masks. Every time we go into the store, we find they're complying. So, but we will follow up on any business that is not enforcing the rule. But I think you're seeing more and more folks used to have no shirt, no shoes, no service. I think at this point it's no mask, no service, and that's to protect everybody. And that's certainly, we intend to enforce that vigorously in the city of Detroit. Now, if you cross the border to Grosse Pointe, they've been more lax, but in the city we've tried to be vigorous, and we are extremely conscious of the African American fatality rate from COVID-19, and we are going to be vigorous about enforcing this.
Okay. In terms of reaching Phase 4, has the governor called for your input on when we are going to reach Phase 4?
We've talked in general, but I would be very surprised if it doesn't come quickly. It appears they just declared the Upper Peninsula and Traverse City Phase 5, which are restaurants. So I would expect that it will come very quickly now. But in our case, the governor's got to make a decision on a region. And if we have the problems you're talking about in the surrounding suburbs not being as serious, I recognize the fact that she can't make a standalone decision in Detroit like she could do in the Upper Peninsula. But certainly we feel like in the city of Detroit, we're Phase 4 right now. I don't know, I'll ask Fame Brown, aren't we ready to go?
I would think so. I think that the temperament and the temperature of the community is in a place to where people are conscious of the risk involved. And so, although businesses are ready to open, and I'm excited to open, our core customer they're conscious of being safe. And so with the combination of both, I think we're definitely ready. I don't see our customers being, disrespectful in the sense to where they don't want to wear a mask. I don't see our customers being so lax to where they're not taking the proper precautions. We want to be healthy. People want to be healthy. And, and as important as business is, without the health of the people, there's no business. So, it goes hand in hand. I'm ready to open. I'm excited to open. We will open. And at the same time, we will practice every precaution and take every precaution to keep our customers safe.
And I understand why Mr. Brown wants to open. He's a businessman. Every day he's closed. That's hurting him and his employees. Mr. Mayor, is it your sense that this is more science or economics and maybe politics that's driving this move towards reopening businesses and states and other places that certain experts say we're not ready yet?
I haven't engaged in the partisan debate in Washington or Lansing. I've stayed away from all of it. All I care about is that the city of Detroit reopens in a healthy manner. And we have brought back now several hundred city of Detroit employees on top of the 3,000 or so police, fire, and bus drivers who are already working. And we are running an infection rate of 2 or 3%, which is below the rest of the community. We know that you can run workplaces with the protocols that are equal or safer than staying at home. And now if our businesses follow the kinds of protocols Mr. Brown establishes, you are going to be perfectly safe going into his store and buying a jacket. You will. And if everybody follows that, there's no reason we can't open this economy back up. And so I've said from the beginning, Detroit stores are going to reopen to the highest standard of medical precautions, and that's what we intend to do. I'm not advocating for restaurants yet, but that's Phase 5, at least under the phases that were released. But I believe we're in phase 4, and we're ready to go on phase 4. And those businesses who want to start, all you got to do is go to the website, and it'll tell you everything you need to know to get ready. And someday soon, I believe the governor will say we're in phase 4, and you don't want to be scrambling for a plan then. Write your plan tonight. Get ready to go tomorrow. Let your customers know you've thought about their safety, and you can show them what you're doing, and I think they'll come back in bigger numbers than if you don't.
And have you contacted the governor to tell her that you think we're in phase 4?
I'm in constant communication with the governor, with Dr. Caldoun, et cetera, and they have a lot of competing pressures, but they've got to make a decision as a region. And so the story you just told about leaving the city and them not being respectful of something, they've got to factor in. And so I don't have any complaint about what the governor's done, but I think we are very close to being ready to reopen the phase 4 businesses.
Okay, and regarding the drive-through testing site where everybody can go now, is that a factor of not enough people are making appointments, or there's more testing resources, or you
Yeah,
know?
well, we're up to 2,000 tests a day. I mean, it's a huge number. We started out, we were at 500. So I said this from the beginning. I wanted us to be one of the first cities in the country to open tests to every single one of our residents. But you had to go in order. So first we had the people who were sick, which were the highest priority. Then we went to the workers, who were the next highest priority. Then we went to people over 60, who were the next highest priority. And now we're opening to everybody. And so we've done it in a way that I think is medically appropriate. But we've just made more deals. We have the help of Ascension Health now, which gives us more capacity. But we can test 2,000 people a day. And if you live in the city of Detroit, because you are a resident of our city, you can get tested for free without any doctor's prescription starting Wednesday. Call today, make your appointment.
Okay, and you said that you don't need to have symptoms. Is there a point in being tested if you don't have symptoms?
Sure. At this point, the great majority of people who have COVID-19 don't have symptoms. I mean, that's the reality. The people who have symptoms were caught. You talk to doctors and nurses in this town. If you've got symptoms, they don't need a test. They know by looking at you what COVID-19 looks like. Our risk is the people without tests. And when Denise Fair and the team went through the nursing homes and found that more than 20% of nursing home residents without symptoms were infectious, it really drove home the point of how this spread so fast. A whole lot of good people who thought they were healthy were spreading these germs. But as I go around the city and I see everybody wearing masks, I see an awareness that you can feel perfectly healthy and still be spreading the germs. And if you just wear a mask, which after a while you just get used to it, I don't even think about it anymore. You just get used to wearing a surgical mask, you protect your family and your neighbors.
Okay, great. Thank you very much.
Okay, Mayor, just a few quick follow-up questions. First one for Ms. Fair. It was reported on Sunday that there were no COVID-related deaths on Saturday, I believe. And Ingrid Kelly from Fox 2 was wanting to know if that number still held or if there was any deaths that came to be reported for Saturday.
No, I don't believe there were, but again, the data is so fluid, which is why reporting on Saturday and Sunday sometimes is not as compelling as reporting on Monday. So my statement that I sent out, I believe yesterday, still stands.
Okay.
I can tell you, what was the date of Saturday?
Been the 16th?
16th. So these get updated literally by the hour. But do we have... We do have one confirmed death on May 16th now. And there may be a couple others. That's why we say don't pay any attention to the weekend numbers. The people phoning in the information from the hospitals in many cases work Monday through Friday. So we continue. This is why we give you results a week at a time, is that a daily number, particularly a daily number over the weekend, doesn't mean very much. But so far we have one reported death confirmed on May 16th. My guess is that we'll probably see one or two more in the coming days.
Okay. Quick question for Mr. Cullen. Ingrid from Fox 2 also wanted to know if you could describe a little bit the nature of Bedrock's and the family of companies' role in helping with the Detroit Means Business program.
Sure, we've been involved with the coalition, all the different members of the coalition, putting together all of the aspects of it, the website, the expertise that DEGC is delivering, the PPE delivery, a number of those other things. We've been Also, from a Bedrock standpoint, very aggressive in working with all of our tenants as well. We have 100 different retail tenants that we've been encouraging both through some financial support as well as expertise and making, and I would encourage everybody to do this, really make visible as Mr. Brown did earlier. I mean, the people that are already open and that can take care of your business right now, the people that soon will be. And then I just want to echo the mayor's comments relative to the restaurants. I mean, they're not open now, but we're working with those folks to make plans, working with the city. Could you expand outdoor seating? Could you do other things to help that business too? So the planning needs to take place now because I think we are really close. We're excited about that.
Okay, and Mayor Christine McDonald from the Detroit News had a quick question about the playbook and wanting to know for certain, are these recommended steps to businesses to take, or is it a requirement?
It's recommended, and at this point, we're trying to do this on a positive, voluntary basis. If we start to see infections spike and see people not following basic protocols, we may make it a condition of your business license or your certificate of compliance. Right now, we're expecting to be voluntary, and I would say, as Mr. Brown said, if you are not protecting your customers, they're not going to come into your store. And so I would think it would be good business for people to adopt these now, and you get one chance to make a first impression as you come out of this. And I would think that as an entrepreneur is going to want to show their customers that you're safe, and that's what you're hearing, aren't you, Fame, from your colleagues?
Definitely, definitely.
Okay, and for Mr. Brown, can you speak a little bit to the other resources that are available now, in addition to the playbook, the help with finding financial assistance, et cetera, that are going to be on the website?
So I received access to the site just last night, and I was able to overlook it. And what stuck out the most to me was the business resources in regards to helping keeping customers safe, right? Access to PPE was very important. It might seem small, but when you think about customers, we average, stores may average between 10 and 100 people a day. And who knows how many of those people will or won't have a mask. At 313, we'll make it mandatory to shop with the mask. And although that's not as comfortable as it would be for even myself to do business, I think it's a necessary precaution at this point. And so we're looking into how we can, leverage what the city is doing on small businesses' behalf to make sure our customers are safe first and foremost.
All right, thank you. That was the last question.
Thank you.